Live now? Yeah, okay, right. Good afternoon to the Policy and Scrutiny Committee for Health and Social Care. I'm the Chairman, Councillor John Nicholson, and members of the committee are Councillor George Cameron, Councillor Andrew Garrett, Councillor Richard Hollis, Councillor John Howe, Councillor Michael Lilly, and Chris Orkin, who I'm not sure is here yet, from Health Watch, and we also have Joanna Smith from Health Watch. There's a number of officers from the various health partners present, and they'll introduce themselves as they speak, please. Housekeeping, can people turn their mobile phones off, please, or turn the volume down so we don't hear them. If you wish to speak, can you indicate through the chat bar, and make sure your microphones are on mute if you're not speaking, and your videos are off if you're not speaking, but please make sure obviously that your microphones are on when you wish to speak, otherwise it's a bit of a wasted effort, and that your video is on so people can see who's speaking. And if you don't mind just introducing yourself, saying who you are and the organisation you represent when you speak, as it's not always immediately obvious in these sort of virtual events. And remember to allow a slight pause prior to speaking for technology to catch up. And that can be variable according to where you are, what sort of service you have, as we know. And only speak when you're invited, please, so that we have some sort of control and clarity during the meeting. Voting will be taken on a roll call, so your name will be called out and you will say how you wish to vote. So all that being said, any questions before I move on? Please indicate through the chat bar if you have any questions. Yeah. No, okay. Right, so item 1 on the agenda is to confirm the minutes of the previous meeting, 14th of September, which, as I recall, was a lovely sunny afternoon. And could I have, could we confirm that this is a true record of the minutes of that occasion?
I'm happy to propose that.
I'll second the Chairman.
So Councillor Lee proposes.
And Councillor Cameron.
Thank you.
Thank you very much.
Agreed, Chairman.
Are we all agreed, committee?
Agreed.
Agreed, Chairman.
Agreed, Hollis.
Andrew, Garrett, Councillor Garrett?
Yes, Chair, agreed.
Yeah, Councillor Howe? John? Yeah,
Agreed.
Thank you, John. Right, to invite members to declare any interest they might have in the matters on the agenda. Is there anybody wishes to declare an interest?
Councillor Garrett, Chairman.
Councillor Garrett.
Thank you, Chair. There are 2 interests. One in any matters relating to the trust, because my husband is applying to the nursing bank at the trust, and second in matters relating to local authority care placements, because I have a relative who is in permanently placed in a care home.
Thank you. Okay. If anything, if anybody realises that they have got an interest that should be declared,
And I just sorry, John, to interrupt. Just to declare that any mention or reference to the Isle of Wight voluntary sector, I am chair of the Isle of Wight voluntary sector forum.
Thank you.
Okay.
So public question time. Have we had any?
None notified, Chairman.
No public questions. So we move on to item 4.
John, I don't know whether I need to declare I'm chairman of the PPG in the West Wight Health Centre, and I'm also chair of the Abbeyfield Society in Totland.
Okay, John, noted.
Thank you.
Chairman, we're due to have item 4 about the impact of the pandemic on the care sector. We're just having a slight problem in getting the people involved into the meeting. Would it be agreeable if we move on to agenda item 5 while we're just sorting out the technical issues, and perhaps then we could take Mr. Bryant, I do know he wants to be released slightly earlier, Chairman.
Thank you, Paul. Yes, we'll do that. We'll move to item 5 while we're waiting for the people presenting on item 4 to log in. And we've had a request from Simon Bryant, the Director of Public Health, if he could go first because he has another engagement. So, Simon, would you like to update us, please?
Good afternoon, Chairman. Good afternoon, Board. I sent a paper through with some information which mainly covers the public health update, including some updates on COVID, which I can give as part of that presentation in terms of some of the data and some of the developments, and a little bit on the public health service provision. So I will just go through that fairly quickly because you've had the paper. As you'll be fully aware, the Isle of Wight is in the medium tier, based on the fact that the rates for the Isle of Wight are less than 100,000, and as of today, less than 100 per 100,000. So that's a 7-day rate. We look at the number of cases in the last 7 days, which is the best indicator of kind of how the pandemic's spreading. As of today, the rate is 28.2 per 100,000. So in the last 7 days, we've had 40 new cases. So whilst the rates are falling, it's just really important to remember that the number of cases are going up because we're getting new cases. We also look at other things such as the rate in over 60s, and that's also decreased, which is really positive. We're really keep a close eye on that because working with my NHS colleagues, we know those people over 60 are more likely to be impacted more greatly by coronavirus than younger people, so may need hospitalisation or other care. So moving on to some key issues, testing. It remains a huge priority for me, my team and the whole system, working with the CCG and the Trust. A number of new testing modalities are coming on board almost daily, including, you'll have heard about the lateral flow test, which is this rapid test to identify people within 30 minutes to an hour. And we're looking at how we roll that out. We are working with DHSC to get our allocation of that. We're also working with the University of Southampton on a library test programme, which should be rolled out in the new year, which is obviously much less invasive than the nasopharyngeal swab, which is can be quite uncomfortable, particularly if you're a child or someone who's got some particular needs. So really excited we've got new testing modalities. The testing centre at New Close is working very well, and equally the government have enabled myself as Director of Public Health to allocate 50 slots should they be needed for the New Close Centre for particular settings. So if we need to get some more slots, we can do that. Moving on to tracking and tracing, you've heard a lot about contact tracing, which is a key public health intervention. So that's about identifying the cases, working out, once they've tested positive, working out who their contacts are, so who they've been in contact with, and that's quite a strict definition. and then following those people up, asking them to isolate. So as of Thursday last week, we started that programme locally on the Isle of Wight to follow up the cases. We pass the contacts back nationally. What that enables us to do locally is to find out some more information, give them some more support, identify any welfare needs should they be required, and enable people to self-isolate when they're positive and identify their contacts who can also self-isolate. We get the cases after 24 hours from CTAS, which is the national system, and follow those up. We're very early stages from data in other areas. About 40% of people follow up, the cases follow themselves up online and will fill in their contact details there and their contacts. Another 40% are contacted by CTAS, the national system, and then we have the remainder to follow up. So that's really positive. We can do that, and I'm really pleased we've taken that on board. In terms of vaccination, very good news, and my paper was a little bit scant because we're getting more information as we go forward. This is led by the NHS, and I'm sure colleagues from the NHS will be given more information, but I'm happy to say that it's very positive. We've seen 2 vaccines be developed, one which has been licensed by the MHRA, and that's the one that requires a very, very cold temperature of -70, so logistically much more challenging. We are, as a system, supporting the rollout of that to the criteria and the cohorts that have been announced nationally to make sure that rolls out. We aren't at that place yet. We're beginning to do that, and you'll see nationally that should be rolling out any day now, seeing more vaccinations coming forward next week. Finally, the paper sets out some key things in the public health services because I'm not just working on COVID. Just to say that with regard to smoking cessation rate management services, key interventions, particularly for the health of the population, but also in light of some of the impacts of COVID, we know these can improve outcomes from COVID. And I also wanted to let you know we've had some really good news around alcohol provision. So you'll know we've come to this committee before around probably about 18 months ago around some of the challenges, and we've really been able to turn that service around and improve the outcomes from alcohol treatment, improving those over the last year. So that's really positive news. Chair, I'll stop there, but as always, very happy to take any questions.
Thank you, Simon, very much for that to the point, very clear report. Members, are there any questions for Simon Bryant, Director of Public Health?
Smith, Chairman.
Joanna, would you like to turn your camera on and speak?
Thank you, Chair. Unfortunately, I'm having problems with my camera, so okay. I won't be able to do that at the moment. I've got a question for Simon about the lateral flow tests. So I understand that the government are keen to use them for relatives to enable visiting in care homes. But I wonder whether Simon has a view on the accuracy of the tests and whether they're safe enough yet to be able to facilitate visiting.
Chair, shall I answer that? Would that be okay? Joanna, thank you very much. A really, really important question. We know that care home visiting is really vital for the health and well-being of residents and those wanting to visit. What the lateral flow test enables us to do, as you say, it's not 100% accurate, and what we need to also think about is the false positives and false negatives. If someone has a positive result from a lateral flow, they should then go and get confirmed by a PCR test. That's the test that's undertaken at Nucleus Cricket Ground or other places. We do know that depending on the setting that lateral flow is delivered and who delivers that, the accuracy can change. So we know that if a trained clinician takes it, they're very, very accurate, and if a member of the public takes it, they're less accurate. So what we need to bear in mind that this is another useful tool in helping keep our care homes safe. So whilst someone takes a lateral flow test and it may come up as negative, but as you're saying, I think you're implying that perhaps not always a true negative. That means that the person should carry on visiting with the right PPE and the right social distancing within that care home. So it's another way of enabling people to visit their care homes and know that they're give safety in the care home, but it's not the answer, and it's not you can have a lateral flow and therefore there's kind of open access to visiting. So it's kind of used in combination with a number of other things to ensure that we keep our residents and our care homes safe.
That's really helpful. Thank you, Simon. I think it's important to make it clear that it's not, as you say, a standalone thing that's going to make visiting possible for everyone now. It's just another thing to be used in conjunction with the other tests as well. Thank you.
Councillor Lilly, you wish to ask a question? Can you turn your video on and microphone, obviously?
Okay, thank you, Simon, and thank you for your staff team working extremely hard through a very difficult time. I've got two questions. One is about sort of COVID, and the other one is about your notes on the public health strategy. Right? The first one on COVID, we're obviously tier 1, and obviously across the water there's tier 2, right? How do we sort of manage that through this, you know, difficult time? Because obviously we have people working on a daily basis going across the water. We obviously still are open to visitors, and there's been some concern that some people are coming here to you know, take advantage of our hospitality opened up. So from a public health, especially from the fact that you manage Hampshire as well as Isle of Wight public health, do we cope and manage with this? Because people are quite worried about, I suppose, preserving our status, right? I'll then, once I had an answer of that, I'll do my second question.
If you care to answer that question, please.
Thank you very much. And I know the Chief Executive wants to follow on from that. And Councillor Lilly, you're absolutely right. It's really great news that the island's in tier 1. All the great work that our population has done to keep levels down. And you're also correct that over the border, Southampton, Portsmouth and Hampshire are in tier 2. So we are working very closely with our ferry companies to start with, and we can talk a little bit more about that. People should follow the guidance of the tier that they live in, and yes, people are allowed to travel for work. We saw that in lockdown, but equally people should follow the advice that they live in, maintaining social distancing and rule of 6. Now for the higher tiers, that means you can meet 6 people socially distanced outside, whereas on the Isle of Wight, that's slightly different. You can meet 6 people outside your family, inside. So you're right, we need to be really clear, and we've done a lot of work, particularly this weekend with colleagues in towns on the northern part of the island to support people to manage that and how we support people on the island to maintain social distance, which is the key thing we should do. And bear in mind the establishments have done really, really well to manage that, and to kind of work with the people wanting to use those venues to keep them safe. But you're absolutely right. It is really important in how we support that going forward. I'll let Chief Executive come in at that point.
John, do you wish to add to that?
Yes, thank you, Chairman. I think Simon has covered a lot of the points I wanted to cover off on. I think we have to be careful to understand that government advice is that people in tier 3 shouldn't leave a tier 3 area unless for specific purposes around education, work or for caring for people. Government advice is less prescriptive around people in a tier 2 area, so they can travel, but if they travel from a tier 2 area to a tier 1 area, they are meant to behave as if they were still in a tier 2 area. And I think we've done a huge amount of work over the course of the last few days, both with colleagues on the mainland and also on the island, to get that message across to help people who may visit the island understand how hard the Highlands community has worked and what they need to do when they arrive here. And I have to say, feedback I've had this morning from regulatory services and the police is, you know, great credit to a great many island businesses who opened up after the end of lockdown and have worked with people who've come across from the mainland, but they've operated in a very COVID secure way and continue to work with our regulatory services team and the police to make sure that they continue to do that. So I think that's all a real positive. But thank you, Chairman.
Thank you. Councillor Lilly, did you have a second question?
Yes, I did. I mean, thank you, John and Simon, for that. My second question is to do with the public health strategy, which you have mentioned, and obviously working on the 20 to 2025. Are you going to, I suppose, facilitate that this is going to be a kind of post-COVID, right? And a population that would have come through this trauma, or the trauma of the crisis, and obviously mental well-being is going to be really at the fore, because people are have been in a state of probably shock, you know, just surviving, and now having to result, you know, whether, you know, they've got jobs and all the sort of consequences that will come into the new year. How is public health, from the mental health strategy point of view, going to make sure that the strategy for the future, because this is going to go on for a number of years, we actually cope with the side effects of COVID that are really going to affect us mentally?
Thank you, Councillor Lilly. You're right, we've had a public health strategy that was signed off by the Cabinet over the summer. Really pleased about that. And one key chapter is about the mental health of the population, because we know that you know, good mental health is good for health, good for the economy, and good for the island. You also we began writing the strategy before COVID hit, and then we did amend it in light of COVID. And we've done a lot of work with colleagues in the CCG and the Trust on mental health, and we co-chair a mental health kind of partnership board, not just focusing on mental ill health, but as you say, mental health, well-being, and all those things that we know are good for us in terms of health and well-being, emotional health, well-being. So absolutely is taking that on board, recognising those things that you outline in terms of the impact of COVID on someone's mental health and well-being. In terms of, we've had lockdown, people have been more isolated, some people have lost their jobs, and we've seen a lot of things there. So we are definitely taking that on board and moving that forward. It's picking up that strategy and really kind of picking that forward. We have, you say, we have been working very hard on COVID, so some things have taken a little bit longer than we might have liked to move forward. So yes, absolutely take that on board, and we're moving that forward with our partners. I can see Darren Cattell, the Deputy Chief Executive of the Trust there, and our CCG partners and the voluntary sector, who are all key to improving health and well-being of our population.
Thank you.
Thank you for that assurance, Simon.
Right, Chairman, you've got Ian Bennett, who's one of the representatives from the outside organisations, who wishes to ask Mr. Bryant a question, and then you've got Councillor Howe.
Right, okay. Ian, would you like to ask Simon Bryant a question, please?
Hi, I hope everyone can hear me. Hi, Simon. It was just coming back to your comments about the lateral flow testing. I'm a director of the Isle of Wight Care Partnership, and we represent care homes on the island. Something that was raised last couple of days with me is the concerns about accuracy of testing, but particularly the comments from the Association of Directors of Public Health, which said that they required substantial resources, human and financial, to deliver these tests at scale. We don't have these resources, and we can't expect them from the council either, given everything that's happened over the last few months. The statement also called for extreme caution, particularly in settings with vulnerable people, which includes care homes. I just think our members are particularly concerned about these two things, and don't see how we can safely manage a return to visiting at any sort of substantial level until we have some assurances. I think one of the big issues is the fact that we're, unlike the NHS, care homes aren't indemnified against being sued for COVID outbreaks, which puts us in a particularly risky position.
Thank you, Ian. Simon, do you wish to answer that?
Yeah, many thanks. You're absolutely right. So with regard to your first point about the resource and the logistics, that was particularly made in light of the fact that if we do mass community testing, as you've seen in Liverpool, the local authority does not have the resource to deliver mass community testing for lateral flow on the scale that you have seen in Liverpool. So we need to be really mindful of that. So that's the key point they were making, because if we want to roll out in the community, we need to understand what those are. As I said, with regard to care homes, it's got to be alongside, it's got to be used alongside the relevant PPE and the social distancing, just as another intervention to ensure that anyone visiting, we know more about their status from COVID than we would if we didn't do a lateral flow. But as you've said, and I said earlier, you know, they're depending how they're delivered, the accuracy of those tests will need to be reviewed, but that's how we're trying to use them. So there's two different aspects there, and I know that lateral flows are beginning to be delivered to care homes for that purpose.
Thank you, Simon. Now we've got Councillor wishes to ask a question. Councillor Howe, can you turn your video on and microphone?
Yes, Chairman, thank you very much for that. And Simon, with these vaccines, I understand, where are they being held for the island? Are they being held at Portsmouth or Southampton, or are they on the island?
So I'm sure colleagues from the NHS will have more information on that. From my perspective, this is a brilliant NHS programme that's hugely logistically challenging, particularly because of the temperatures required for the first vaccine, and Portsmouth Hospital is the local hub where they'll be stored. We were waiting for the MHRA, so the medical the agency that's responsible for doing the safety checks, to allow the vaccines to be split out of their larger packs to then be delivered to settings across Hampshire and Isle of Wight. So
our vaccine that's been allocated for the Isle of Wight will be held at St Mary's, will it?
Can I ask Deputy Chief Executive of the Isle of Wight Trust to come in? I think he's indicating he may have more details than I have on that.
Okay, thank you, Simon.
Okay, thank you. Darren, did you wish to, could you just explain to people who you are before you speak?
Of course, John. Thank you very much for the opportunity to respond to that question, Councillor, and thanks, Simon, for your initial response. Darren Cattell, for those who don't know me, I'm the Deputy CEO of the Trust. I'm here on the island, St Mary's. Just to pick up on your particular point, John, Councillor Howe.
You call me John, please do.
Thank you. That's very kind. Thank you, John. We haven't had absolute confirmation yet as to how and when the vaccines will arrive on the island, but we do have the facility to store the Pfizer vaccines in the Trust as and when they do arrive. We're waiting for that, and it should be any day now, John, but as soon as we know, we'll pass that information on.
That's excellent. Thank you very much.
Darren. Michelle, did you want to add to that? Could you just explain to people who you are?
Yes, of course. Hello, everybody. My name is Michelle Legg, and I'm a GP at Tower House Surgery, and I'm in my room at the moment, been seeing patients today, and I'm also the clinical chair of the CCG. As it stands presently, and it should be noted that this changes almost hourly, we will be actually receiving a group of vaccinations of 975 arriving on the island around about the 14th, 15th of December. And initially they will be going to the Western Central locality for distribution and stored in refrigeration in the Carisbrooke surgery. And as we understand, later that week, another cohort of vaccine will be coming to the island, and the week after a third cohort, so that all localities will be able to vaccinate a proportion of the ambulant over 80s.
Good. Thank you very much for that.
Chairman, just for a clarification, if I may, on this, who is actually over who is actually in charge, responsible, or are there different groups of people responsible for different areas? And will we know who's responsible for who and what for distribution?
Would you like me to continue on that? When you say responsible, do you mean overly responsible for distribution of the vaccine, or do you mean who's responsible for actually vaccinating people?
What I meant was somebody who is responsible for who actually gets it and where it's supplied and how it's distributed across the island.
Of course.
And you say you've got some there, and the hospital's probably got some, and
yes,
you know, and somebody's got them in the back, in their house, in the kitchen, in the fridge.
No, unfortunately, no, definitely none in anyone's kitchen. This is being I wouldn't necessarily use the word mandated, but NHS England have designated which groups will be vaccinated first. Now, initially, it was going to be the care home groups of vulnerable people. However, because of the nature of the vaccine and how it needs to be stored and how it can only be transferred a few times, the cohort which NHS England has designated to be vaccinated first in the community is the over 80s who are ambulant. And that means obviously that's not the housebound, it's the ambulant over 80s. They will be the first cohort that will be invited to vaccination the couple of weeks before Christmas. And then there are several categories who will be vaccinated next. And it is the vaccine characteristics which is actually determining which group will be vaccinated first. So if, and at the moment it's still with MHRA, the next vaccine, which is the Oxford vaccine. Now the Oxford vaccine can be stored much more easily and used and distributed really easily. We would be easily able to quickly vaccinate care home patients, people with that vaccine, but we're just waiting for the vaccine. And so it is actually the vaccine type which is determining who gets vaccinated first.
Okay.
Is that what you wanted to say, Darren? Darren, did you want to add to that? You're okay. Okay.
John,
Right.
Just to add, really, we're all working incredibly well and hard together in trying to navigate the way through this. As Michelle said, things are changing almost on an hourly basis. So as and when we know more, we'll pass some more information on through to your office, and then we can distribute that.
Thank you.
Yeah, absolutely. That's absolutely, just to clarify.
What it's like, you guys know what it's like. Once they start doing the vaccinations, somebody has got to complain that they haven't got this, they were due this, they had the right to have it and they haven't got it or something. And I just wondered whether there was somebody between you that was actually take the responsibility for making that judgment.
So I think what John's saying is if we receive any, if people have got a complaint or a concern, who specifically do they go to?
As Darren has said, firstly, we are working together, and we should also add that we've been able to work with the council very well as well. If somebody's got a concern about timing of vaccination, I'm sure that they can address that to the CCG, but actually the groups, the cohorts of patients that have been determined, that has been done nationally. It is not a local determinant. We haven't chosen on the Isle of Wight to vaccinate the over 80s first. That is what NHS England and I and the government have determined.
Good. Well, thank you for that, and thank you for the questions. So we're now done with that item.
No other questions, Chairman. So did you want to go back to item
We'll
4?
go back to item 4 because we've now got Belinda Davis and Ian Bennett here. But before we do that, for the latecomers, I'll just run through the protocol. Can you turn your videos off when you're not speaking, videos and microphones, and turn them on, obviously, when you are speaking? And can you just make sure that any background noises eliminated, i.e. mobile phones. So we'll go on, and if you wish to speak, if you use the chat bar, the officers will pick it up here at the council, and your name will be called out to speak. Right, so item 4, the impact of COVID on the care sector, and for this we've got representatives Belinda Davis from the nursing sector and Ian Bennett, who we've already met, representing the residential sector. So Belinda and Ian, in any order, over to you.
Hello, I know Belinda's having a few issues with her internet connection, so I will give her the opportunity to jump in, but I shall start. I think just to sort of start with some general comments, I think it's really important to say at the outset that the council were responsive and supportive at the beginning of the crisis. We couldn't have asked for better, really. They worked with us to provide what support they could. In some of my meetings nationally, I've heard of a lot of sharp practices from different local authorities withholding cash from government grants and things like that. And it was really good that we didn't see any of this from the Isle of Wight Council. I think there was, there was a massive impact on the providers who suffered an outbreak. The island, I don't think, got it as badly as other places. Of our 6 care homes, only one of them had an outbreak. When that happened, though, 50% of the clients were infected and 25% died. Although it's important to say most of these were very elderly and often had comorbidities as well. I think it's really important to start there with all the positive stuff, because obviously it's there is some other negative stuff that happened as well. Just coming back to the lateral flow testing, because that's sort of what's on everyone's mind at the moment. The comments from the Director of Public Health were useful. I think my concerns about the resources required are more about the evidence we've had from some of the providers who were in the pilot, who have spoken about having one full-time member of staff on all day just doing testing, because I think it's quite an onerous process, and it's, our resources are quite stretched already, and it's how we manage that. I don't know if Belinda has anything she wants to come in on now. Is she able to? No, I'll take that as a no. I think the other one of the other big areas that we had concerns about were workforce. Throughout the first wave, there was a really big impact on our workforce, mainly because we didn't have testing. So lots of our staff were being required to self-isolate through, just having a cough or a bit of a temperature. It's been less bad in this second wave, as far as I'm aware, mainly because we have that testing now. So we're more able to determine whether somebody actually has COVID or not. I think the big issue now is the increase in stress and mental health absences. I'm sure it's something that the local authority is experiencing as well, particularly in their own provision. We've seen an uptick in our vacancies. I think that's probably the same across the sector. And although we've had a bit of a spike in people from the EU trying to get into the country before January, I think after Christmas, it's going to be a real challenge because of Brexit to try and fulfill those vacant positions. I'll just give Belinda a chance to come in if she's able to. No, okay. The other area was hospital discharge. I think everyone was aware from the news that people were being discharged to care homes without testing. I heard of a few instances of that happening. I know the Director of Adult Social Services here, Carol Tozer, was quite hot on that from the beginning to say it shouldn't be happening. I think it did, just in the desperation to clear the hospitals early on in the crisis. Sadly, I have heard reports of this starting to happen again, despite really strict trust guidance sort of prohibiting it. I think there's always that balancing act of safe discharges from hospital and trying to get people out of a setting which clearly isn't appropriate for them quickly. And finally, just on the bits I wanted to say before I let anyone ask any questions they have of us, which is the elephant in the room at the moment with the fee review on the horizon, and that's funding. The main issue across the sector is vacancies. I think the national picture is that around 70%, there is 70% occupancy in care homes. you'll all know that margins are tight in our businesses at the moment. So any number of vacant beds causes real vulnerability for some providers. That's something that I think really needs looking at. We've had some money from the infection control grant. It works out at about £115 per bed per week, but that's required to cover a lot of things, including staff absences due to testing positive, and loads of additional stuff, working from home provision, improving our Wi-Fi, stuff like that. So it doesn't actually stretch as far as we think, and also the measures that we could expect from Rishi in his budget in March, including VAT increases, capital gains tax increases, things like that, which will really impact our bottom line and cause increased vulnerability in the sector. I'll just give Belinda another chance to come in, and then I'll let anyone else ask any questions. Oh, she's just texted me to say she's dropped out, so I won't do that. So if anyone has any questions, I'll be happy to take some. I know it's a bit of a whistle-stop tour, but I didn't want to go over all of the stuff that we already know has been happening. So yeah, ask away.
Thank you very much, Ian.
You've got a question from Councillor Hollis first, Chair.
Right, Councillor Hollis, you wish to ask a question?
Yes, please. Thank you, Mr. Bennett. You talked about, sadly, the sort of number of deaths in the care home, etc. How do we know the percentage of people who died with but not from COVID? I mean, for example, a lot of men die with problems, but they're not necessarily from. From the prostrate or something like that. With regards to COVID, how many people? What is your guess or do we know how many people died with and not from? And the other side is how do we know? It's so easy to say, well, someone died from COVID, but actually, put down a cause of death as COVID, but actually it's something else. I mean, I do know a number of doctors, and it's registering a death is not exactly an exact science.
Thank you, Councillor Hollis. To answer that.
Yeah, that's fine. I think it's sort of a bit beyond my area of expertise, really. I mean, we go by what is on their death certificate, which comes from the GP who registers that death. I think it's safe to say that a number of the people that died in our care home setting, and I can't talk for everybody, probably would have died anyway within a few months. I think that what happened, and what we never expect, is that all of it took place in the space for about 3 weeks. So I think it's safe to say that although many of these people were very poorly and were close to the end of their life anyway, having COVID sped up that process. But again, I'm not a doctor. I didn't register the death, so I think you'd probably have to speak to primary care for a proper answer about that.
Okay, well, thank you very much.
Thank you very much. Now we've got Laura Gordian. Laura, could you just explain to people who you are before you speak? Thank you.
Of course, Chairman. My name's Laura Godian. I'm the Interim Director of Adult Social Care and Housing Needs at the local authority. It's more a couple of comments, if I may, Chairman, than questions to follow up on points made by Mr. Bennett. The first in relation to hospital discharge and the assertion that we're starting to see patients being discharged from the hospital who are COVID positive into care homes. I'd like to extend an invitation to the independent sector to contact me directly with instances where that happens, because that hasn't been raised as an issue to date, certainly in relation to the second wave. And I'd welcome the opportunity to facilitate a conversation with colleagues at the Trust and the CCG if that's the case. My second comment, Chairman, if I may, is in relation to the funding challenges which have been raised by Mr. Bennett, which are challenges which I'm all too aware of from my close relationship with the independent sector and the support we've been able to provide both as a local authority and also through facilitating the allocation of the Infection Control Fund. We're currently at consultation with all independent sector providers, and I would encourage providers to make sure that when they're returning their submissions in relation to the fee review and the local authority and CCG rates for next year, they're clear to include all of those additional pressures. It's only if we know what those additional pressures are that they can be factored into our thinking and our determination with finance colleagues around care home fees. I hope that that's of assistance, Chairman.
Thank you very much, Laura. Thank you. And now we've got a question from, or a statement from Claire.
Claire Golan.
Sorry, Mr. Chairman, could I just come back quickly on what Laura said? Thank you. It was only actually raised with me this morning, Laura, at a meeting we had with commissioners. It wasn't a criticism of the trust or their policies, because I know that that's in place and they're trying to work towards doing it properly. It wasn't about people being tested being discharged who are positive, but it was rather the lack of testing that happened within a few hours of their discharge. And absolutely, we're in communication with all of our members to say, please include all of the costs in our fee review statement. We hope you actually get more of a response than we have had in previous years.
Thank you. Claire, if you just explain who you are.
Good evening, my name is Claire Gowland. I'm the Director of Operations from Planned Care at St Mary's Hospital. And again, I just wanted to comment on the discharges, Chair. We have quite a robust system now. We have meetings twice a day to review every single discharge patient who leaves the hospital. And the checks are that those tests, the tests go in place. I think some of the confusion that's happened is the national guidance is that those tests have to have occurred within 48 hours of discharges. And I think some of our care home providers are seeking for a test that day. So there may be a conflict with some of the national guidance. Again, if you do find that there are any cases where patients you don't believe have had a test within 48 hours of discharge, if that comes back either through Laura or to the trust, then we will certainly look at that. But we do have key points during the day where we check every single patient's status before they leave the hospital. Thank you.
Thank you, Claire. Who specifically at the trust? Should any concerns be referred to?
In the first instance, if you come through to the site management team, they're 24/7, so there'll be access to any time, and we can do a review of any patient.
Right.
I will have oversight of that.
Is that okay with you, Ian?
Yeah, that's fine. I mean, we've already been asked to raise it with the commissioning team at the meeting this morning, who I'm sure will feed back to the appropriate people at the trust. Like I say, it really wasn't meant as a criticism of the hospital. I just think it's, these things always happen, particularly around hospital discharge, when stuff gets left out that it's supposed to. It's a perennial issue and something we have.
A valid point to raise at this sort of meeting, and thank you very much for the reassurance from both Claire and from Laura. Thank you very much. So now, Councillor Lilly, we've got a question from Councillor Lilly.
Thank you. Ian, firstly, can I thank your sector for the really gallant work, all the people that work in that sector through this difficult time, because actually you've done a fantastic job. And I mean, I have a number of care homes in my ward, and I know in Ryde, right across the island, I've actually heard some fantastic stories of absolute kindness and beyond the call of duty in protecting, your residents, and also very much keeping links with their families that obviously have been distressed through this particular time. My question is, this is an opportunity through Scrutiny to actually ask us, ask Isle of Wight Council or of what you need to actually rebuild, right? After COVID and the time, what are the particular things that you would like to put on your wish list, right? So that we on this committee can make sure that they're minuted and followed up. To hear your voice from the sector, and I really welcome that you've actually come to Scrutiny, because we don't have that opportunity to always hear all the voices from the different sectors.
Yeah, thank you, and I'd echo all your comments about the frankly amazing work that a lot of our staff members have done over the last sort of several months. It's been really, really heartwarming to see the commitment that they have. I think I'm glad that you've invited me to sort of outline my Christmas wish list that I'll put in the post to Father Christmas this year about rebuilding our sector. I think, in a perfect world where, I could have anything I want, I'd say I need more money. I need to be able to pay my staff more. I need to be able to maintain pay differentials at fee reviews. I need to be able to have ready access to lateral flow tests that are accurate and easy to complete, so we can get visiting going again properly. But in the real world, I know that all of that may not be possible. I would like to say that actually we always have had an open door with the local authority, particularly since Carol Tozer and Laura Godian arrived. So I think that's sorry, I'm just trying to see messages from Belinda that's popped in. So I think she's echoed what I've said. A meaningful increase in fees is probably the key thing that we're looking for at the moment. But yeah, everyone understands the challenges that we all have, and what is a meaningful increase in fees. But I think the important thing for me is being able to maintain my pay differentials, not just having an uplift that says the national living wage has only gone up to the over 21s, when actually we pay every 18-year-old who does the same job the same money. I'd like to be able to, when minimum wage goes up, I'd like to be able to increase the fees for my senior staff by the same amount, because that's becoming more and more challenging every year. So I think those are the main issues, and sadly it comes down to money, which is a bit disappointing. And I know that it would be nice to have some more fluffy things, but without the cash we can't provide any of that.
Thank you. Can I ask a supplementary question to that, John? You actually mentioned about recruitment and staff. How are staff being supported? Because I'm very concerned, of the staff who've worked right through. I have a number of residents who work nights, and they've worked solid night shifts right through since the first lockdown. And I would actually like to know about their welfare and support, because obviously, they must be pretty exhausted.
Could I come in here? Thank you, Councillor Modsdale.
Can I ask my question, Councillor Modsdale, first of Ian?
You asked about the mental health. I just wanted to say something to Ian, if that's okay.
Yeah.
Yeah.
Fine by me.
My daughter actually works in the sector, and I have to say that the stuff that the care homes have put in place to protect their staff's mental welfare has been absolutely stunning. There is, I know we're hearing about cash and things like that, and I understand that it is limited, but the way that the managers and the owners of care homes, that especially the one that my daughter works in, has just been absolutely incredible. The protection of that staff and understanding of what they've been working through has been really good, with occupational health, any referrals they need has been really good. So, my personal thanks to Ian, you have been incredible.
Thank you for that.
Yeah, thanks, Claire. And just for your question, Michael, I think I can only speak to our sort of group of care homes. It's something that we've always considered. We personally offer the opportunity for our members of staff to have counselling. We encourage them to take holiday when they need to, and when we feel like they're being overworked, if it's safe for them to do so. There's not a huge amount that we can do for them, but we do what we can. We offer support. We have mental health training in place. Our managers have an open door. They can always talk to them. They often are a shoulder to cry on, and an area of support. And the managers in particular are my area of concern, really, because often you talk about people doing night shift. These managers have been working 14, 15, 16-hour days for 2-3 weeks on the trot. and it's really, really stressful and very difficult for them. But we do what we can, and I think every care home I speak to has stuff in place for managing the mental health of their staff, because I know personally it's probably our biggest cause of absence, particularly at the moment.
Can I just say thank you, and a big thank you to your managers and all the people working in the sector for all that you do. Thank you.
Thanks.
Well, I think we've got Councillor Garrett now.
Thank you, Chair. Mr. Bennett, you spoke about the recovery of the sector, and I'm just wondering the extent to which you understand what sort of horizon that is, how many years for recovery, because obviously you're here before a scrutiny committee that's looking at health and adult social care, but you could very much appear before a scrutiny committee looking at economic regeneration and development, and certainly it feels to me that sectors across the island are looking at several years to recover, and there is a role therefore for the local authority from an economic support, the economic development side of things, to be looking to your sector and working with you to identify those things that will help you through not just the next year whilst we're still dealing with COVID, but actually in those very much those post-COVID years. So are you looking at 3 to 5 years or something for sector recovery?
It's really difficult to talk. You said no. Sorry, it's really difficult to talk on behalf of the whole sector. Our business, actually, we're not suffering the same vacancy levels as others. I would expect that's the big issue. If you think we normally have vacancies where you have one, at most 2 or 3 people who die in a course of a month, and then that causes, obviously you have to then refill those beds. It doesn't happen instantly. So you then, if you have 70% vacancies, you've lost, almost a third of your clients, then it takes much longer to fill those beds. So you have that issue. You have the issue of Brexit and staffing, and I think that's going to cause another lag in trying to get those services open and fully functioning again. And also, I imagine there are a number of groups who have eaten into financial reserves and money which would otherwise be used for investment on the fabric of their building, because at the end of the day, we're an asset-based business. We have buildings that need to be maintained and kept to a high quality, and I think that costs a lot of money. So those are the areas which I think we're looking at to recover. On a more positive note, and I'm basing this on a report that was done by Lang and Bryant early on in the crisis. They spoke about 70% vacancies sort of this year and into next year, but then it would spike to being almost full in the year or two after that because of the demographics. So because we're seeing care home closures, whilst demand is increasing because people are getting older and going into care more, actually I think the prospects for the sector over 2 or 3 years are not as bad as they look now. That's what I'm telling my bank managers anyway. Yeah, I think there are some homes are definitely going to be struggling. I would imagine there will be some closures. I see Laura wants to come in here. I imagine she's got some more insight into that as well.
Yes, please. Laura. Hello, look. Yes, Laura.
Chairman, I on a daily basis track the activity across our local care market through a capacity tracker, which is a tool which was developed by DHSC and implemented nationally. We're very lucky on the island because our providers have embraced that tool and are completing it with over 98% completing it within 72 hours and on a 72-hour basis. So it is very up-to-date information. What I can tell the committee is, as of this afternoon, based on this morning's return, we only have 4 care homes on the Isle of Wight across nursing and residential who are operating at less than 80% capacity. The rest of our care homes are operating within normal parameters. In addition to that, of the care homes that we currently have, over 60% are full or have one placed. So the impact across the care market that's been seen nationally hasn't been reflected in our local marketplace. And largely, I think that links back to what Mr. Bennett was just saying in relation to the Langbuisson survey. The Langbuisson survey has tied occupancy to an ageing demography within an area. And what we know on the island is our demography is already ageing. So we have a higher number of people who live on the island in that 85 years plus age range, which has helped to stabilise our care homes. We've not seen care homes losing residents and large gaps remaining for significant period of time, where care homes have been impacted as a result of a COVID outbreak through that wave one. What we've done is work with those care homes to support them to build their client base up again so that they remain sustainable. I'm not anticipating, as I sit here before you in my interim director role, a significant number of care home closures locally. I would be very surprised if over the next 12 months we saw more than 1 or 2 care homes closing locally, and my view in relation to that is the reason they close will not be linked to the COVID outbreak and pandemic. So I hope that provides the committee with some assurance in terms of the steps my team are taking to monitor the situation, and I can also confirm that on a weekly basis contact is made by telephone with every single registered manager on the island to undertake a temperature check, make sure that they're supported, to address any specific concerns they're raising through their returns, and to provide signposting and guidance in relation to the support that's available to them.
Thank you very much for that, Laura.
Thanks, Laura. I can always rely on Laura to have the best, most up-to-date data, so thank you for that.
Right, okay, so I think it's in order we've already thanked the NHS and we continue to thank the NHS, but I don't think we've had an opportunity to formally thank the residential and nursing home sector for all their efforts, particularly here on the island, that they take to look after our elderly. So I'd just like to take this opportunity, Ian, to thank you for the part that you play and continue to play and the great efforts that you strive to make.
Thank you, and thank you for giving us the opportunity to speak to you today.
Good. Thank you. Okay, so we'll go on to item 5A, which is the Isle of Wight CCG, and this is to receive a verbal update on vaccination planning and on the mental health recovery pathway case, including an update on the future use of Shackleton Ward. Now, who's going to speak on that?
I've got Leslie Stevens, who can do the recovery service in Shackleton.
Leslie.
Thank you, Chair. Although this is down as a CCG agenda item, I wanted to speak to it. I don't know whether Alison Smith's on the call, but we'd agreed that I'd feedback on behalf of the CCG. We're working very closely on this.
And James. Yeah, so Alison, James, Joe Smythe and Steve Parker and Maggie are all from the Trust. So
CCG as well, though.
Yeah, there's CCG as well, yes. All right.
And the other thing I wanted to say is I understand that there'd been some delay in getting the slides through to you. There were some slides for this, and I think the ones that were in the pack were old. So I don't know whether Paul had managed to get the up-to-date version and send them through.
We received them.
Yeah.
Okay. All right. So thank you for that. If you wouldn't mind just going to the next slide, and I can just briefly talk you through. I know it's very difficult to see small, certainly on my screen, it's difficult to see it. What I wanted to do was just to update you on progress with Woodlands, and then briefly touch on Shackleton. This committee will be very well aware of the plans that we have in place for Woodlands. Woodlands currently is a 10-bedded inpatient mental health rehabilitation ward. And we've been working for some time on a plan to modernise the service, and as part of our transformation programme as set out in the new mental health and learning disability strategy, our plan for Woodlands is to develop the service into a community-based service, and we're working with a housing provider to transfer the inpatient provision into supported housing, and that would require deregistration with CQC. We have previously spoken to the HOSC about the Review and Scrutiny Committee about this plan, and you've been very supportive of it, and we're continuing with conversations with NHS and I, and they also are very supportive of the plans for deregistration. We are on track to deregister by the end of March, as we've previously said, and the next slide, if you wouldn't mind, just sets out an overview of the actions that we want to take in preparation for that. And I think we'd agreed that we would come back to this committee in the spring with a further update on where we are with Woodlands. The next slide, please. No. Okay. Apologies. It's clearly getting a bit stuck somewhere, so we can make sure that everyone has a copy of them. So if I just move on, the next slide actually is, as I say, it's an overview of the plan for progressing this piece of work. It's all on track at the moment, and we expect to be able to move to the new model from the beginning of April, as we've previously said.
Is that the chart, Leslie?
Yes, that's right. It's a
chart, Charlotte. Can we have that? Right, it's not.
No, okay, it's fine. I can just talk through it. There's I don't think a lot I want to say about the chart, other than it gives you some assurance that we're looking at all aspects of this plan to progress it. The final slide is with reference to Shackleton Ward, and this really is just to give the committee a brief update that as things stand, we continue with our intention is to continue with the plans that have been in place since Shackleton closed for the next 3 to 6 months. We've done quite a lot of work through the strategy with the engagement of the staff and service users and wider stakeholders to determine the future model, and there's more detailed work now needed to scope the next steps with regards to the next 3 to 5 years for dementia, specialist mental health dementia care on the island. So again, our request is that we come back with a detailed plan in spring to overview and scrutiny that will set out those plans. They will continue to include the provision of a dementia outreach service, which is a community-based service, in order to minimise the admission of people with mental health needs and dementia. At the moment, we are needing to use Mainland beds, and our intention is to look at further ways of reducing the use of Mainland beds, and to provide alternatives on the island. And those are the plans that we'll bring back in the spring. Thank you, Leslie. Well, this has been a very, very good piece of work, and it's been greatly supported by this committee. So we're very grateful to see any updates and the progress that you're making. Could you just remind us, for those who may not be aware of the route that we've taken on this, just exactly who's involved in this, Leslie, please? So for both services? Yes. So both services are delivered by the Trust, our mental health and disability services. All of the planning work that we're doing hand in glove with the CCG, and we're working very closely with a range of partners across the system, including the local authority and third sector partners. So it's been a very kind of inclusive piece of work across the system.
It certainly has. So we've got questions from Joanna Smith and then Michael Lilly. Joanna.
Thank you, Chair. So I just wanted to begin with the recovery pathway, just to say that this is a fantastic piece of work. It's a really brave and innovative plan. It's taking services to where they need to be, and the quality of the plan is evidenced through the engagement that's been done with people that use the services. And I know that a huge amount of engagement has been done over the past, particularly the past year, around woodlands, and that's been at the forefront of all the plans. So it's a fantastic piece of work, and you know, credit should go to Leslie and everyone at the Trust for being brave enough to do this. It's a totally different way of working, but it's what people want, and it's what people need on the island. And as I say, it's very brave, but it will pay dividends because it will change people's outlook, because it's truly based on recovery, not just on the medical model of people, you know, going in as an inpatient and then coming out and lacking the support and then going back in again. This should change all of that. So it's really exciting. I've just got one question about Shackleton. So will future plans of Shackleton involve any beds, acute beds on the island for people with dementia and complex mental health needs? We know they're going off island at the moment, and it's just not acceptable that people, particularly at this present time, have to go off islands to seek the treatment they need. And it's difficult enough for anyone having to face treatment off island, but when you've got significant problems due to dementia or Alzheimer's, that's compounded. So I just wondered if you are looking at inpatient beds on the island.
Well, first of all, thank you for your comments about the recovery pathway. I really appreciate that. With regards to dementia beds, we don't have a plan to set before you today. We will be coming back with a plan, and in developing that plan, we will be continuing to engage as widely as we can, as we have through this whole process. Our intention is the outcome we want to achieve is to stop or to absolutely minimise sending people off island to mainland beds, and there are a number of ways that we can achieve that, and extending the community provision is one of them. Developing dementia beds on the island is another, but we need to work through how we would achieve that. I know this committee will be very aware that we're in this position because of quality concerns around Shackleton Ward, and there are real challenges in delivering very highly specialised, very small services that are isolated. And what we don't want to do is recreate that service. So we want to be absolutely assured that we can do this in a way that it improves outcomes and is safe, and that's the exercise that's before us over the next several months. I think there are a number of options for us that would potentially bring beds back to the island, but we need to test that through the process that we're planning.
Thank you, Leslie. Councillor Lilly.
So I got one or two questions. Nice to see you, Leslie. I have to just come on the back of Joanna and really thank you for this journey, right? And actually going beyond lip service of the word recovery, because I think it's been used for many years, and you know, was a lot of inaction and misunderstanding about the word. So my first point on, and I'll come then on to Shackleton, but on woodlands, I still hold you to your promise of the 1st of April, right? I will be there. I think that in your planning, pathways are extremely important. This is about steps and about people, going up and coming down. So part of a woodlands and recovery model is to prevent people going into acute, right, and get them sort of supported to get back into the community as quick as possible. And the other way is then getting people from acute, if they're unfortunate, being there down into back into the community. So it's for pathways, and I would like to see more, I suppose, more evidence about those pathways in the community, because the more that we have those supportive infrastructures in the community, the less likely people are going to actually need even to go to woodlands. Within that, it is about building resilience and prevention. So in your planning of doing that, are you building in the foundations for that pathway, because it is a pathway model? If you could answer that, then I'll come to Shackleton separately.
So I completely agree, and absolutely we are. So the new mental health and learning disability strategy sets out a kind of seamless pathway of care. I think what we've tended to do historically is expect people who use our services to fit into the services we choose to deliver, and actually what we need to do is wrap our services around the needs of individuals. So, and that takes a really substantial culture change. What's really critical is that we move services upstream, we get in earlier. I completely agree with you. We need to, if we can avoid an admission, then we avoid all sorts of negative outcomes for the future. And so the best response for us in terms of improving outcomes for people with really complex needs, including in this kind of woodlands, rehab arena, is to focus upstream and to catch people early and to prevent them deteriorating to that extent. So we are investing in primary care mental health in third sector, and our local mental health services that can be much more responsive and intervene earlier.
Thank you. In Shackleton, well, can I ask a first question, then a second question? How many people are off island at present, right, that would have been on island if there was adequate provision?
So I believe there are 4 off island at the moment. And one of the challenges we have with off island placements is that organising discharge is a slower process than it would be on the island. So we've not increased the number of beds that we use in terms of total number of beds. In fact, I think over the period since Shackleton's closed, actually the occupied bed days off island are much lower than they were. But it's still too many, and there's more work to do.
Because my last question is to do with these individuals are human beings that are part of families, and the separation from those families on the mainland must be incredibly traumatic for those families. And how are their needs, i.e., the carers' needs, right, are being sort of fed into this question? Because often it's the family that are more distressed in a way than the individual that needs cared for.
Yeah, no, absolutely. So we work, the dementia outreach team specifically works very closely with the family of each individual that's placed off island, make sure that communication with them is really good and that they get the right support to visit and keeping in contact in the way that they most find most helpful. And we will continue to work with families and carers in planning the service in the future. It's really critical part of this work.
Thank you, and thank you for all that you're doing. Thank you, it's appreciated.
Thank you both. We've had a question while we're on this particular subject, following on from Councillor Lilly. we've had a question from Councillor PC Wilcox, who's looking in, and she would like to have assurance that that you've got enough staff to operate this new pathway, particularly as it was one of the failings of the which brought about the closure of Shackleton Ward. So yeah. Some reassurance, Leslie.
So from a financial perspective, we have, because we pay for the beds on the mainland, and actually we'd much rather pay for beds on the island than on the mainland. So the money is there. The challenge is finding the right skill mix, the right, having the appropriate band 6 nurses with the right skills to be able to work in that ward and so on. And I think one of the challenges we had with Shackleton Ward is it was an entirely standalone service from all of the rest of our mental health services, and it wasn't possible to support that ward with staff from other wards and to work in a more collaborative way, just purely because of where it was located. So I think if we are going to develop further beds, I think it would probably need to be within 7 acres, where it would give us much more opportunity to look at how the team work together to be able to deliver those beds, and that would increase the chances of us being able to staff it in the way that we need to. So all of those factors need to play into the decisions about next steps.
I think it's fair to say, Leslie, your whole approach on this it's refreshing and reassuring. So thank you very much, and you'll continue to receive the support from this committee in whatever you want to do in this pathway. Now I've got a question from Councillor Howe and then Councillor Garrett. John?
Right, I'm ready. I'm all set up now, sir.
Okay.
My question is related to lay law. In lay law, you had a fitness suite which was used for people that needed physical looking after. Can you tell me when lay law, when it will come back online, or whether it's going to stay as a ward for a long period of time?
So I think one of my colleagues may be better able to answer that question. I think right now my understanding is that the facilities that you're talking about that need to come back online are likely to once we're through the winter pressures. I don't know whether
that's really in the next section for the trust, because we're on the CCG, even though Leslie is on the trust. It's a bit confusing.
Right, do you want to leave it till we go on to the
John? We'll let Darren respond.
Okay.
John, my suggestion would be, both Johns actually, we pick that up in the next section.
Okay,
is that okay, John?
So question noted and will be answered in due course. So now we got Councillor Garrett.
Thank you, Chair. And it may be that my question, because it's on a line in the Trust Board papers that's going this Thursday, is in the next section, but I'll put it and you can tell me otherwise. I may have missed it, Ms. Stevens, in what you were saying, but in the Trust Board papers it refers to experiencing pressure on mainland specialist inpatient dementia beds, and I just wondered, I'm new to this committee, it may be something others know about, but what are you meaning in that context?
We're seeing pressure on mental health beds across the board. So we're certainly seeing that on Ireland. Our beds are much greater demand for our beds than we've had pre-COVID. And that's true for mainland beds as well, and that includes dementia beds. And I think the other thing you'll see in the paper is beds for children and young people are also under pressure, and so we're working in an environment where it's much more challenging, and we think that that's relating to the COVID impacts on mental health, which we know have got a kind of broad impacts on the community, but we are seeing a real surge in demand with higher acuity, more complexity of cases coming through to specialist mental health services. So it's something we're working through with our commissioners and partners on the island, but we're also working very closely in the ICS space with mental health colleagues in Southern and Solent, and more broadly actually across the region to look at solutions for that.
That's helpful, because obviously if we are particularly reliant on having, unfortunately, to send people across the Solent, if there is pressure there, it adds that additional thing. So I'm looking forward to what you said will be 7 months of work in this area, but looking forward to seeing that come through this committee as it's presumably sort of mid next year or a little bit later.
We wanted to come back in spring, so in the next 3 to 6 months.
That's great.
Yeah.
Right. Thank you very much for that. Is there anything else from the CCG? So we got Alison and we got James here. Is there anything else from the CCG? And Michelle, of course. We've heard from Michelle. I think we've heard about the vaccine. So, were there any other updates that you wanted to give us under this section? Not sure. Not sure if any. Were you trying to get in, Michelle?
No, I'm just would actually just give one very brief update, if I may, Chair. It's more a primary care update, but since it is commissioned by CCG, I'll take the opportunity just to let everybody know that primary care access is completely open. We're seeing 10% more patients than we did in January of this year, and certainly about 15,000 appointments a week are being seen, and about 60% of those are face-to-face appointments. Just to reassure counsellors, we do still do telephone triage, and that is so that we keep our staff and other patients safe, so we can talk to patients firstly on the telephone, and then if we think they need to be seen by either a GP or an advanced nurse practitioner or the nurse. We've also got mental health practitioners. We've also got first contact physios now. There's a whole range of professionals that support us in primary care. We then make arrangements for them to be seen. The process is often much quicker than previously. It's just a different way of doing things, and we are mindful of those more elderly patients that can't use e-consult or are not quite so comfortable with online technology, but we are very much mindful of that, and we deal with that appropriately.
Thank you very much, Michelle. Joanna.
Thank you, Chair. So this is not directed at Michelle, although I know you've got an interest in this. I can't not take this opportunity just to raise the issue of dentists. I appreciate it's commissioned by NHS England, but dental services are the biggest health inequality on the island at the moment. We've received a huge amount of feedback from people around access in particular. People cannot get access to an NHS dentist. So we've just started a piece of work on this, and we've launched our survey. We've already had over 400 people complete the survey, and we've had some really quite awful stories that people have shared with us. So many people cannot access a dentist. One person's been trying to find an NHS dentist for over 12 years and still hasn't had any success. We've heard from families whose children have never seen a dentist because they can't access an NHS dentist. We've had a huge amount of people having to refuse dental treatment because they can't afford it. Some people are borrowing money to get necessary dental treatments, and we're seeing the longer term effects. So at the beginning of the pandemic, people were contacting us because they were in excruciating pain. Now we're seeing the longer term effects. So people are coming to us and they can't chew food, so they're having to eat a soft food diet, and this is severely limiting what they can eat. And there are a number of people now in this condition. As well as that, we know that head and neck cancer referrals are very much reduced on the islands. So dental services haven't been able to pick up head and neck cancers. We're also looking at people that are suffering from depression, severe psychological problems because of the issues they've got with their teeth. So this is an absolutely huge issue on the islands. One, caused through lack of NHS dentists on the island, and two, caused by the fact that even people that are registered with an NHS dentist, many haven't had an appointment for a long time. The other issue is problem with specialist dental services. So we know that they're a fantastic service, but they've got a huge waiting list. So people with additional needs are having to wait a very long time for support. So as I say, we're doing a piece of work on it, but I can't stress enough how important this is and what a huge impact it's having on island people at the moment.
Joanna, I think that any information you have on this, we would be very pleased to receive it, and we will take it up with NHS England. We did raise the issue of dental services with NHS England, and we had some informal meetings with them a few years ago, if I remember rightly. And I think this is really important. It is something that should fall within the workload of this committee, and I think that we will definitely take it up, and with the support of other health partners, perhaps.
Can I make a proposal on that? Sorry, Councillor Lilly.
Please, Councillor Lilly.
I think this should be on our agenda at the next meeting because it is a significant issue, and Joanna is wonderful in raising it, and I do think we have got a possible legacy of people and particularly children with dentistry problems for many years to come, and I think we should make this a priority issue. It is a tragedy happening.
We will do, and we'll deal with it in the meantime. We'll send a communication to NHS England requesting immediate response to this. So I think, yeah, we'll take this up in very robust form.
Can we minute that, Chair, fully?
Yeah, that's been done. That's been done. Every so often at this committee, we have to raise an issue in public interest and of concern. And I'm very sad today to have to raise the issues that are being forwarded to me about Cowes Medical Centre. There's an alarming concerns being brought to the attention through the Cowes Northwood Place Plan and other Cowes organisations and initiatives about the difficulties that patients are having in obtaining satisfactory levels of service from Cowes Medical Centre in particular, which is causing unnecessary stress, delay and frustrations to those patients. It's also quite plain that such inadequate levels of service and accessibility that now exist has the potential to put sick and vulnerable people in the community at unwarranted risk. We have reports of people not being able to get appointments when needed, of not being able to speak to anybody as the phone is seldom, if ever, answered. And trying to use the web contact service is like running a marathon of irrelevant questions that give the impression to those trying to help that they are being obstructed from doing so by whatever device can be put in the way to block patient flow. For those who do not have a computer, internet service, or are not savvy with modern IT, it is impossible. Some say that trying to get into the medical centre is more difficult than trying to get into Parkhurst prison. Such is perceived the stockade mentality of the inhabitants. There seems to be a serious communication issue at the medical centre, where they think that simply putting notices on the website is sufficient to inform patient community. There is no effective communication with outside bodies, at least that those that need to know are aware of. In this respect, at least, the medical centre is dysfunctional in its care and in its duties. People are concerned and wondering if the medical centre has lost its focus on assisting the community with which it is charged to attend, becoming an introverted and self-centred, that their focus has shifted to matters serving their own convenience, safety and internal operation. Clearly to those outside, but perhaps not to those inside the stockade, at the loss and disadvantage of their increasing desperate patients. There is even suspicion that cows, being one of the only practices not to take up blood test services, may be doing so because of finances, which, if true, would confirm that the descent of this practice into seeming to put its own benefits ahead of that of its patients. It is also noted that the patients' participating group at this medical centre resigned en masse. It appears the writing is on the wall. But is this practice so absorbed in its own indulgence that it has failed to notice the light under which all good practices should operate? This committee asks, as the last bastion to which public can turn to with its concerns, that the controlling body, the Isle of Wight CCG, lift the veil on what is happening or not happening at Cowes Medical Centre and make strides to resolve the issues and return the practice to an acceptable level of service. And in that effort, it will receive the full support of this committee and through it, the council. So that's a statement of the state of affairs as reported to me from various sources. It is a matter of concern, and I just wondered if in due course we could have a response to address the issues raised. Thank you. John.
So, thank you, Chairman. I don't think anybody knew what you were going to say there. The medical practice are clearly not here to be able to offer a right of reply. I think we've only got Michelle from the CCG, so my advice would be that we ask the CCG to investigate what you've just set out and ask them to bring a report back for you to a future meeting. Because as I say, I think it's a bit unfortunate. The medical centre haven't got a right to reply, and I think it will be wisest that we don't have any further debate on the matter, but just invite the CCG to work with you and work with the committee to explain the position so that at the next meeting, the members of the public can have a full hearing and understand the particular position. As I say, I don't think it would be of benefit to have any further debate on the issue.
Right, thank you. Darren.
Just to agree entirely with John there, John. if not too many Johns. John Metcalfe's point.
Yes, it's Michelle, and I couldn't agree more. I think it's really important that we clarify the facts. And just to be sure, you mean Cowes, not East Cowes surgery?
Cowes.
Yeah. So, and I think John's said everything that I would say, really. But yeah, let's work together and look at this.
That's fine. That's fine. That's good enough. So, if we move now on to the next item, which is the NHS Trust, and this is to consider an update on performance and quality, winter preparedness and response to COVID-19, the recovery of services and key challenges, temporary change to leadership in community services and staff recognition. Darren.
Thank you, Chairman. I'm conscious of time, so what we'll do is take the presentation as read if you're happy with that, members. I'll just lead off with a few introductory comments and a couple of thanks, actually, and then invite colleagues Claire Gowland, who introduced herself earlier on, and Alice Webster to talk through some specifics of our performance and our flu, preparations for winter, as you say, and then towards the end, I'll pick up the leadership changes and also then just focus on a really positive aspect, which is our staff recognition, not just locally within the trust or on the island, but certainly at regional and national level to some extent too. Some good news to whet your appetite for the end of the presentation. So really then we're going to talk through, and I'm going to hand over to Claire now, but just thank you really to all our staff who've been absolutely fantastic through this period since the pandemic started, but actually, and I also want to thank the community on the island as well, because you've been incredibly supportive of the organisation and the staff within it, despite a number of very difficult circumstances. And Claire will talk specifically, but as Michelle said, we've got the trust is well and truly open for business. Not all of our services are operating at 100% pre-COVID. But most of them are, and Claire will talk about where we're working really hard to get those. Clearly, we have a number of those services operating on what I'll call a socially distancing policy, and certainly in line with infection control procedures. That said, I'll hand over and just remind Alice to pick up on John Howe's question around Lateral as we progress through the presentation.
Thank you, Darren. Thank you, Chair. So yes, I think, as Darren says, we are very much open for business, and in fact our focus continues to be on enabling patients to access our core services as and when they're needed, to maintain our elective services, and also to provide a responsive emergency services as well, whilst responding to the very real threat and presence of COVID, and also managing our plans for winter. If we look at our emergency care activities, so at the moment calls to NHS 111 are significantly up on last year. We're looking at about 148% increase, or 148% compared to this year of calls answered, and the calls answered in since 60 seconds have increased from 87% to 83.2% for the same period last year. We've been working very much with the CCG and our ambulance division to look at ways of reducing attendances to ED and really promote the NHS first to ensure right patient, right place, right time. Our ED attendances for the period that we're looking at, and the data is for the week ending the 22nd of November, are approximately 19–20% lower than this time last year. We did see quite a spike of not only attendances, but also the acuity of the patients coming through the front door in September and at the beginning of October. At the same time, at the beginning of October, we saw an increase in COVID activity as well, which I'm really, really delighted to say has been tailing off over the last few weeks and actually is now down into very low single figures in terms of patients being treated as. If I just go on to our outpatients, so overall our outpatient activity continues to increase. We're looking at overall outpatient activity about 90% of pre-COVID levels. And in the previous 4 weeks, 25% of our activity was delivered in a virtual capacity, so telephone, video consultations, reducing as many face-to-face activities as we can, but also recognising that for a number of our service users, that is the only way that they are going to be able to access our services appropriately. So it is really trying to tailor to the needs of our individuals. In terms of diagnostics, so the Trust has added a CT and MRI scanners to help ease the backlog created by wave 1 of COVID. And some of our diagnostic imaging services are performing well, with some services exceeding our pre-COVID levels. So if we look at CT scanning, ultrasound scanning and our MRI, we're actually above last year's activity. I'm going to hand over to Alice now to talk about the flu vaccination programme, and then I'll come back afterwards with our winter planning.
Thank you.
Okay, thank you, Claire. So my name is Alice Webster. I'm Director of Nursing, Midwifery, AHPs and Community Services at the Isle of Wight NHS Trust, for those that don't know me, and I'm delighted to be here this evening, so thank you. To pick up the point first, else I might forget it, around Lateral. So Lateral is currently being used for an inpatient bed setting. It relates to ensuring patients are able to be stepped down from the acute setting prior to going back to an onward residence, which may be their own setting or care home. Indeed, there were some areas of provision that were day services that were used during the Lateral period when it was a day hospital. Those have been offered elsewhere, and at the moment we certainly plan on keeping the inpatient beds open during the winter, and they are being managed through the community. So hopefully that answers your question.
Can I just ask the continuation? As far as I know, at the moment, the only alternative to Lateral is at Rise. So it's a long way for people, say, who live in the West Wight to travel. Newport was far enough, but sending them to Ride. And you're telling me there are a number of other places now that are open for physio?
So certainly people can still receive their physiotherapy on the St Mary's site, and they can receive it in Ride. But if you've got a specific example, Councillor Howe, I'm happy to pick that up with you offline if that would be helpful.
Thank you, Alice.
Well, I would like you to do that. It'd be great, because I think that we could make more use of our fitness rooms in the sports centres around the island, which I managed to do for myself, but there are people that haven't done it, because I'm a member of the West Wight Sports Centre, and therefore I can ask for a physio to come in with me.
Okay, I'm happy. I'll make contact. I'll get your contact details, and I'll make contact out of the meeting with you, and we can have a look at it.
Chairman, can I just ask one very quick question? Do you know whether, I understand that today that people weren't able to book, or doctors weren't able to book blood tests because the computers have gone down. Do you know that?
I can't comment on that, I'm afraid. It's nothing that's been raised to me, but I certainly can't comment.
Oh, I just wonder whether anyone from your team would actually know whether it's only a temporary thing or whether it's going to take some time to come back.
John, we can't answer that at the moment. We'll have a look at it for you and come back.
Thank you, Darren.
Thank you, Darren.
Okay, thank you.
Thank you.
So hopefully that's answered that question. Just to briefly, I'll take the report as read. I think it's really important to know that many of you will be aware we were expecting a visit from the CQC in November. They have postponed that visit, and we don't have a new date for it. Part of that was down to the lockdown. We have maintained that contact with them, and we're doing that through a virtual basis. And we continue to make the improvements across the organisation. But I guess the key thing is we are continuing to make these improvements because it's the right thing to do for patient care. It's not about doing it for the CQC, it's about doing it for our island and our islanders. Around the flu, we haven't seen a huge number of people coming through with flu cases. However, what we have seen is an increased number in our staff wanting to receive the flu vaccination. And previous years, we've had sort of in and around the 50%, 60% range. This year at the moment, and we're still early into the flu campaign, we've got a 70% uptake on frontline staff. So that's really, really positive, and our thanks go out to those people that are vaccinating. The other area of focus, of course, has been with COVID and managing patient safety and staff safety whilst on our sites and out in the community. Hands, face, space and ventilation are really key, and we continue to work with that, and I'm delighted Joanna and others through the work we've done with them have said that people coming into the site feel safe. We are providing face masks, hand gels, and ensuring that we maintain that distance, and that is really, really important. We might be in tier 1, but it's significantly important to manage as we go forward over the coming months. We are part of the vaccination program, as has been alluded to by Simon Bryant earlier in this evening, and we will manage the NHS Health and Care Worker programme through the Trust, and we will support the CCG in managing that out to the wider community. And as many people have said, it changes on the hour. I think the other part is the lateral flow testing, which again we have participated in. We have got lateral flow testing for frontline staff, but not all of our frontline staff are on the lateral flow testing because of the number of kits that we had come down from central government. So as soon as we get more testing kits, then we'll be able to do that. And again, was interested to hear Mr. Bennett's conversations around the sensitivity of them. So, you know, I'm happy to take any specific questions that anyone has, or leave it to the end and to pass back to Claire for Winter.
Thank you. No questions so far.
Lovely, thank you.
Claire, thank you.
Thank you, Alice. Thank you, Chair. So again, I'll take the report as read, but I just want to highlight a few points in terms of the key actions we've taken in terms of winter planning. So we now have mental health liaison cover in the emergency department, and that's increased to 7 days a week, which is a particular support, especially when we see some of the fallout from the COVID period and beyond, and as we enter not only or come out of another phase of lockdown, but enter the festive season. We've also had the introduction of point of care testing for COVID-19 in the emergency department. This is currently undergoing validation, but this will certainly help us in terms of our placement of patients right from the moment they present to the front door. We've embedded our COVID and non-COVID clinical pathways. So we have hot and cold, or COVID and non-COVID pathways now for our emergency department, for our intensive care units, and also for our ward bases. So they're very much embedded. And as I think we may have mentioned last time, we've got ring-fence beds to protect our elective activity. So that's ongoing. In terms of our priorities and next steps, I think it's fair to say that we always knew that workforce was going to be a challenge, and it is. So we're continuing to support our staff in terms of staff health and well-being, and also on our staffing levels throughout the trust. And that's not just the number of staff that we have in post, but also making sure that we have the right skill mix and the right support and the right training for each of those areas. And that's quite dynamic, as we have, we still have instances of staff sickness, COVID and non-COVID related. So we manage that on a daily basis through certain key points in the day. We're working with our system partners to monitor performance and take action as necessary to address winter pressures, COVID pressures and general operational pressures. And I think it's fair to say that over the last few months, the relationships and the working with all aspects of this, the system have continued to go from strength to strength. Colleagues will know that I say this often, not one of us can do this on our own, and that's absolutely true. But we've got some really good relationships and some really strength in our working across the system. In terms of our COVID-19 response, as I say, we set up a second ICU so we could increase our capacity for patients requiring intensive care and make sure that there was an absolute separation of COVID and non-COVID patients. We also have some robust escalation plans in place should we see a further or sustained increase in COVID-19 admissions. This includes plans for utilising beds at St Mary's, and it's very, very clear the escalation policy that we've got inside there. We're working very closely with Alice in terms of Director of Nursing and Infection Control and our infection control teams to make sure that patients, any moves around the hospital are absolutely necessary for a clinical point of view and are actually, and are safe. We also continue to make sure that as many staff can work from home as possible to reduce the presence in the hospital, whilst making sure that we have a responsiveness from a managerial point of view to our key staff. The COVID numbers you will have seen from the pack, we started to see an increase at the beginning of October. That has started to come down. Obviously, we are prepared for the post-Christmas to see what happens after that, and we remain responsive. In terms of the recovery, I alluded to this a little bit earlier in our planning, but one of the slides there just shows by breakdown of each of our services, diagnostic services and day case services, where we are in terms of our activities. So I'll leave that for people to read. And then finally from me, in terms of our key risks still, workforce continues to be a one. Our staff sickness is nowhere near as high as it was during wave 1, but we are still seeing an increase in the number of staff reporting sick. We're hopeful that with lateral flow testing, that will help us to manage that most certainly. We are seeing a number of referrals from primary care much lower than normal. So the worry with that is it means fewer people are being diagnosed and sent to hospital for tests or treatment. So we continue to work with the CCG to make sure that we keep our doors open and make sure that patients are accessing the services they need. Improving our discharges. I know we spoke about it earlier, but we have an integrated discharge team that is embedding practices brilliantly across and provides a real good link with adult social care, with our community division, with mental health, and also with the providers in the community. We continue to link in with them on a regular basis and make sure that if there are any issues with any part of discharge planning, we can address that very, very quickly. And as I say, the elective programme continues. I don't have any other updates, but I'm happy to take questions. Thank you.
Thank you. I don't think we've got any questions, but there is a question skimming through the Trust Board papers for this Thursday. There's some new language in there which jumped out, and that is the Trust continues to be clinically and financially unsustainable. And I think from my quick skim, it's mentioned twice. I wondered if you might be able to explain or expand on that. Would that be you, Darren?
Yeah, I think so, John. I'm happy to pick that up. So if we think about the risks that Claire's just talked about, a lot of it relate to people. So and two aspects of that for me. The first relates to our workforce and working incredibly hard through very difficult circumstances, as is every health and social care partner on the island, including the care homes, as Ian Bennett was saying earlier on. But we don't always have enough staff in the right place at the right time. And working with partners on the mainland and on the island, we can make sure that those key staff members are available for when and if we need them. So working with partners ensure that predominantly clinical staff are available in greater numbers to meet the needs of our population. In terms of finances, covering those workforce gaps leads to an expensive use of agency or locum staff, off-island and high cost. That leads to an unsustainable financial situation for the organisation, and we've seen that occurring in its deficit positions over the last few years. We also know that because we're an island, we incur premium costs to deliver what we'll call emergency services, so 24/7 services, so accident and emergency or maternity cover 24/7. Those services are relatively expensive in comparison to our neighbours, because we have to run them 24/7, but we don't necessarily always have the number of patients to generate the income in terms of tariff coming forward to cover those costs. So there's a clinical and a financial unsustainable position for the island. What we're doing, of course, is working with partners to ensure that those services will continue and, where necessary, expand. And we can only do that working with partners on and off island.
Darren, how would you respond to people that might hold a fear that we're going to lose our Isle of Wight Trust status and be handed over entirely to a mainland trust?
Yeah, sure. Well, we're very proud of the Isle of Wight Trust status, John, as you know, and we're working incredibly hard as an organisation to maintain as much of those services as in greater depth as we possibly can for the population of the island. We're working with the partners to ensure that sustainability, and at the moment there are no plans to change the status of the Isle of Wight Trust.
Thank you. Right, we have questions now from Councillor Garrett and then Councillor Lilly. Councillor Garrett.
Thank you, Chair. I was, like you, looking through the Trust Board papers, and I was just noting the latest chart around the recovery side of things, which of course brings us is further on from what's presented to us today. What I noted was quite some variability in 2 or 3 areas: inpatient, day case, and endoscopy. I was just wondering, is that to some extent just an artifact of working week on week, or is that showing some sort of perhaps systemic sort of issues that arise otherwise? And should we, in terms of interpreting these figures, should we be looking at them from a scrutiny perspective more on a month by month basis to smooth that variation?
I think it's a really good question, Councillor Garrett, actually. In the interests of providing information, we're doing that on a very frequent basis. So, excuse me, sorry. What I would suggest is that we wait for a longer term trend, but there are issues given the relative size of some of those services where, for instance, a surgeon has a couple of weeks holiday. You can see the variability in that over that sort of very short frequency. But let's come back to that as we progress through over the next few weeks and months, but nothing certainly that we should be overly concerned about at the moment.
Thank you. Councillor Lilly. Michael? There he is. No.
Sorry. Thank you, and again, thank you for all the work that you do at the NHS to actually keep our service going, which is extremely important. I think one of the things that is, in a sense, obviously the focus has been on COVID, right, and being able to respond to that. What is the kind of horizon looking that obviously a lot of people have other, I suppose, other illnesses that have actually, in a sense, you could say, been repressed. I don't think there's people not necessarily coming forward, perhaps on different conditions and things, because obviously in a crisis like that, people, don't want to be a bother, as it was. I've had 2 residents in my ward who recently have died extremely quickly and unannounced, because actually they haven't necessarily come forward where they would have normally done within pre-COVID. So I just wondered, what is the pressure going to be on the trust when actually we start to come out of COVID with the vaccination, etc., and you have this possible rise, right, of people who needing the services. The point about dentistry was a good example of this, where people are actually the standard of their teeth and everything across the island is probably deteriorating, and probably need more increase services. I don't know if I've made myself sort of clear in that or understanding, but for instance, is there going to, is there a lot of cancers escalating higher? Are there, could there be more heart attacks because people are not reporting symptoms perhaps at early times?
Thanks, Councillor Lee. I think you raise a fantastic point, actually. The kind of unmet demand or unmet need of patients in the population of the island is something that concerns all health and care providers at any time, actually, but particularly during a pandemic. We've worked really hard, all the partners on the island, to try and provide information and accessibility to all services that we all provide, be it through primary care, be it through adult social care, or be it the trust themselves through community or mental health services or the acute and ambulance services. In fact, what we tried to do is put additional services in place. And one of the things I think we'd really like to highlight is the 111, the NHS 111 service that's been a real success. And actually what we're seeing is now a demand of about 120, 130% in comparison with the previous year. So I think people are responding in the right way to access services. It's too early to say in terms of any evidence to support the hypothesis that you posed there around patients sort of waiting too long for treatment. But we are working really well and hard with Island partners, particularly around primary care, to make sure referral levels are increasing up to the level that we'd seen before, to make sure that patients aren't waiting unnecessarily for treatment. Just reiterate the plea really that we are open for services. Some services may be restricted, but we are open for all services, particularly high urgency and demand for emergency care.
Thank you very much. Thank you.
I seem to remember, Darren, at the last Trust Board meeting, in some departments you were working at 120% capacity in the catch-up.
Certainly right. Claire, I think, referred to some of our diagnostic services. We bought an additional MRI and a CT scanner online only in the last few months, and those services now are operating at something like 120, 130% as well, above last year's activity levels, so we can diagnose patients a lot sooner than they perhaps were before.
And what about this phone app? Are you going to tell us anything about this phone app for transmitting photos of cancer?
I haven't got much information on that today, John, but perhaps we can do that at a future meeting.
Okay, it's just something interesting for members. It's a very good news story peculiar to the island, and I think most of us heard about it on the national news.
Oh, we missed a trick there then, by the sounds of it.
Yeah. Okay.
Darren wanted to do the leadership bit in staff acquisition.
Just very briefly then, John, through you, we've recognised that Alice can't possibly continue to do two jobs. She's the Director of Nursing and the Director of Community Services. So over this winter period, we've asked Leslie Stevens, who you met and listened to earlier on, to take over the community service leadership as well as mental health and learning disability. And Alice will just focus he says, in inverted commas, on the Director of Nursing role within the Trust. Given all that Alice has got to do, I think that's more than enough. So I just thought we'd mention that to colleagues on the committee.
Thank you very much. Thank you, Darren. Staff recognition.
Yeah, this is a really positive story in the sort of last page of the slide deck, and it's really a recognition of our staff are working incredibly hard, but actually it isn't just us that are recognising that. We've had Nursing Times awards, Health Service Journal awards, NHS Parliamentary Award for Lifetime Achievement for one of our staff, and the Health Tech Digital Awards, and that's a massive thanks to the collaboration that we've had on the island around the technology-enabled care for putting video consultation and electronic monitoring equipment in our care homes on the island. Really accelerated rollout program during the first phases of COVID. So some massive recognition really, and it just shows that not only us but other people are recognising the huge efforts and the impact that our staff are making, and we're really proud and really pleased with that.
Good. Thank you very much for that, Darren. So, in the absence of any further questions, we'll move to the last item in this section, which is adult social care, to receive a verbal update on COVID.
Chairman.
Yeah.
So sorry, before you move on, I'm afraid both myself, Claire Gowland and Alice Webster need to leave. We've got something else we need to do, I'm afraid. Is that possible?
Okay, yeah, of course. Thank you.
Okay, apologies for that, everybody else, but
thank you for saying.
Thank you.
Thank you, Chairman. Could you just thank all the staff? I know a number of them are leaving now, so I'll say it now, that we would like to thank them. We've managed to keep our down to tier 1 and who work very hard to support the island.
I think that's a very good point, John. We haven't arrived at tier 1 through accident, and I've already personally thanked the CEO of the council, public health, director of public health, and the leader of the council for their efforts in making the island case. And I think it is entirely appropriate to also thank health partners. We're extremely lucky that we're in tier 1. So yeah, thank you.
I second that, John.
Yeah, we do try to make their life a bit awkward by asking awkward questions, and they always get back to us and always let us know the best way forward. Yeah, I can see you.
Thank you, councillors. Much
you.
appreciated. We'll certainly pass on those thanks to our staff. Thank you.
Good. Right. So now we go to, I think it's Laura again, with adult social care. John, video.
Thank you, Chairman. It is. I hope not to take up too much time from the committee. I'm conscious of the time this evening, but I've been asked to provide you with an update in relation to COVID, to winter planning and to the Q2 report that was considered by Cabinet in terms of adult social care performance. Starting firstly with COVID, I'd normally update you in relation to the situation in our care homes and in relation to testing and vaccinations and all kinds of things like that. I am incredibly fortunate that my colleagues in public health and the independent sector have already done so, so I will keep my update light in that regard. Internally, staff levels across adult social care, which includes our care management and internal provision, remain green across all of those critical services. What that means is we're not showing any significant fluctuations in staffing that can't be managed. Staff are working hard and they're addressing increased numbers of people who are presenting with increasingly complex needs, and that takes its toll on our staff group. We're seeing attendance across the whole of our adult social care and housing needs team remaining high in spite of increased levels of stress and increased levels of anxiety following on from the second lockdown and the complexity of the people they're working with. Chairman, through you, I'd like to thank the Council's Human Resources team and Learning and Development team for the exceptional support they've put in place for my staff across adult social care and housing needs in relation to their mental health and their resilience. We've seen a lot of time and energy corporately invested in supporting our staff to be as resilient as they possibly can, and I credit that resource with the impact it's had on my staffing levels across adult social care and housing needs. The staff themselves can't go without my recognition to you as a committee, and ordinarily in March we would have seen the Adult Social Care Conference taking place. As part of that conference we have our annual award ceremony to recognise what our staff are achieving, and we've decided to hold that as a pre-Christmas event this year. On the 18th of December we'll be celebrating that success across our service, and I'm pleased to inform the committee that nominations closed today. And from their peers, we've received 44 nominations for our staff in terms of their outstanding achievement over the last year. We will be contacting colleagues to help us evaluate those and determine the winners of those awards in due course. The team continue to work very closely with public health colleagues, and that's a relationship that we've seen strengthen since March, with much closer working across the two departments, and that closer working is focused on supporting care homes in terms of testing, provision of PPE, infection control, and now moving to supporting loved ones to visit their relatives in care homes in the safest way we possibly can. We're also working with colleagues at the CCG and at the NHS Trust in relation to the Vaccination Program, and will continue to do so to show our support there wherever we can. I think it's fair to say, Chairman, that the COVID-19 landscape for adult social care and housing needs is a fast changing one. The landscape alters almost daily, sometimes hourly it feels, but I can report back to the committee that Wave 2 has had a lesser impact across all of our services than Wave 1. And when speaking of our services, I speak obviously of colleagues in the independent sector and voluntary sector who support us to deliver our island-wide social care offer. Turning to our winter plan, Chairman, I was asked to provide you with an update, and you may be aware that DHSC required for the first time this year adult social care up and down the land to submit a winter plan by the 31st of October. It was a tall ask with a very limited time for turnaround, and what I'm pleased to report to the committee is that we were able to work on that plan and produce it not only by the deadline, but in partnership with our wider health and social care colleagues. The independent sector, the voluntary sector, the CCG, our colleagues in the Trust, and also Healthwatch were able to feed into that plan to ensure that it reflected a true version of our aspirations for winter across adult social care and housing needs. It's not a particularly target-driven plan, and it's largely based around the support we'll work together to deliver for people who need social care support. And Chairman, I'm happy to share that with the committee should they wish to see it. It is published on our web pages, so it's readily available. It forms part of the system-wide winter plan rather than a standalone, so is complementary to the wider systems objectives around winter planning, and that was submitted to DHSC in accordance with their timelines and accepted by them. We're awaiting further feedback. We've received that regionally, but national feedback is still on the agenda. We will obviously share that with committee members as soon as it's available to us, should it become available. We're not entirely sure whether we will be receiving it or not in due course. Finally, Chairman, looking at performance and the Q2 report to Cabinet, which was on the 12th of November, the Performance and Finance report provides details in relation to the Adult Social Care and Housing Needs Department. For members of the committee, paragraphs 15 to 22 and Schedule 3 specifically detail some of the key achievements of the department, and I make no apologies for flagging those directly with you here. The report shows that the department continues to work closely with NHS colleagues to support hospital and national requirements around discharge, and that's proving ever more successful. It shows that the newly established Ethical Task and Finish group has developed best practice for supporting people who lack mental capacity in residential care, as well as for mental health, well-being and resilience, and that's been shared by the Local Government Association as best practice. The report further shows that the homeless and rough sleeping strategy, which was approved by the Council in November 2019, continues to deliver. The number of people in unsuitable accommodation and temporary accommodation continues to decrease. And the good news, Chairman, is that no family or children have been accommodated in bed and breakfast since March 2020. So some key headlines there in relation to the success of the service up to September 2020 in that Q2 report. Chairman, I'm happy to take any questions in relation to either the verbal update I've just provided or more widely in relation to adult social care.
I don't think we've got any questions, Laura, but I think it's appropriate and fitting to say that that we note the strides that you and your colleagues have taken to improve the adult social care service, which only a few years ago was pretty dire. We also note the initiatives that you've instigated, not only within adult social care, but externally with the with care homes and with health partners. And I think that what you've done and what you continue to do is exemplary. And also for your lightning fast response to those occasional very urgent cases that get referred to this committee and in turn to you, and how fast you pick those up and actually deal with them. So I think a note of appreciation I know you're new to being an interim director, but I think you're doing a very good job.
Thank you, Chairman, and I'll be sure to share your feedback with the wider team.
Any questions? No, that's right. So no questions. Now the work plan, which is the next item on the agenda, will be updated following today's meeting. Now all partners should know, if they don't, I wish them to know, that if you have any items that you think we should be considering in our work plan, then please feel free to contact me or the scrutiny officer, Paul Thistlewood. As I say, I think we've got a good enough working relationship amongst ourselves that we know that already, mainly through the informal meetings that we enjoy. There's no members' questions, so there's no members' question time. Thank you very much, everybody, for making the effort to come along. I noticed we've had quite a good attendance. Not everybody has spoken, but I hope you've been listening, and I hope it's been informative. And we're just coming up to 2 hours, 25 minutes, so not bad for one of these meetings with so much to consider. Thank you very much, everybody, and good night.
Thank you, Chairman.
Thank you, Chairman. Very good meeting.
Thanks, John.
Bye-bye. It's like the captain on the sinking ship. Got to be the last one out.